really excited to announce that we're going to have a partnership with Newton-Wellesley Hospital. So Newton-Wellesley has a transitional year, and our residents will go through that transitional year as their internship. It's a community hospital very close to Boston, and it's a hospital that's really known for a great balance between strong clinical care but also wellness, and they have very strong quality improvement projects. And I think the breadth of that experience was what drew me to making a partnership with them.
We're excited to have the Mass Eye and Ear interns join us next year. We recognize from a programmatic standpoint that this is yet another great group of individuals who we recruited to a well-known program to join us and to work alongside of us. I think from a programmatic and systemic standpoint, it allows us to take a look at our rotations and think about how we build them and how we support the intern experience.
I think one of the best parts about the Newton-Wellesley Transitional Program, especially for applicants into ophthalmology, is the balance of both medicine and surgery exposure. So house staff have the ability to go to the operating room, to be working alongside surgeons, learning very important skills, as well as to working alongside very dedicated and interested medicine doctors, learning about complex medical disease that often has manifestations in ophthalmology.
Over the course of the intern year, the interns will rotate through many different services. The rotations, to get a little granular, involve a rotation on a surgical service. That surgical service is actually split into two teams. There's a colorectal team and an acute care surgery team. We have surgical attendings who are very specialized. They work in robotics and things of that sort, and so have really made that surgical rotation one of the favorite rotations over the past few years. On the medicine side, there is a day medicine rotation and a night medicine rotation. The experience on the day medicine side is carrying a list of patients throughout the course of a month, following that panel of patients, both admitting and discharging them. And I think it's a very valuable experience, because to be able to see one patient from the time that they're admitted to the time that they're discharged carries a wealth of learning and experience, and we really do try to focus on the intern being that person's primary doctor in the hospital. That relationship is something that can't be replaced.
I think another thing that's really special about the program is the relationship that we have with the program directors there. So in forming a partnership with them, they reached out and asked, what are the things that ophthalmology residents need to learn as an intern? What are the foundations they need in medicine? And they're very willing to help tailor the intern year to the things that our residents need.
My program directors are Dr. Mike Gibbons and Dr. James Bartz, and they're really wonderful and truly caring. They always have an open door policy, and I always feel like I can talk to them about any issue. I can text them, call them, email them anytime. What I like the most about them, that they're especially considerate to international graduates such as me, and considerate about the challenges that they have.
And by creating the environment where we welcome everybody's contribution, we value questions, we celebrate diversity and different backgrounds, I think it really allows a safe training location where the best learning can happen.
We are very happy to say that we have built structures within the teams that allow the heterogeneity of the different folks who are rotating with us at Newton-Wellesley to really contribute to the overall experience. So for instance, on a medicine rotation, one Newton-Wellesley intern from a transitional year program may be working alongside an ophthalmology intern or alongside a psychiatry intern or anesthesia intern. Additionally, we have interns who rotate here from the MGH medicine program and from the Tufts internal medicine program. Those categorical medicine programs also give us third-year residents to serve as the supervising residents for these teams. So it's really a joy as a hospitalist to be on these teams and to watch these different individuals from different programs and different backgrounds with different future interests be able to work alongside and contribute to the team.
One of the greatest perks that we have here is, I think, our wellness program that we have, and that includes coaching, it includes really taking care of our interns that we have. We also have a very open door policy. So one of the perks that I think that we offer is the ability to come into our office and sit. I think there's nothing better than having residents come here and laugh and hang out and grab a piece of candy, tell us about their families. There's nothing better than that.
I'm actually really excited about the wellness program. I'd like to describe one of the aspects of it is a professional coaching program that we have. And we meet with our coachees several times over the course of the year to help them identify their goals for themselves and their professional growth over the course of the year. It also is an outstanding resource for that intern to have a go-to person when they need to try to unpack a difficult situation or experience that they have over the course of internship year.
So it is very interesting to work with not just like diverse co-interns who are going into different specialties, but also to rotate through different specialties. That way you kind of don't just see everything from the perspective of, let's say, the medicine physician, but you also see the perspective of the surgeon, you see the perspective of the ER attending, and you understand more about the thought processes basically behind the actions of the other attendings and the other departments, and you understand the workflow of the hospital just much better.
We truly do value elective time here as well at Newton-Wellesley. It's a chance for a trainee to individualize their experience and to build into that intern year some of what they may hope to take forward in addition to the usual core clinical rotations. Specifically for the ophthalmology interns who we look forward to rotating here, they will have the opportunity to actually spend time at Mass Eye and Ear. We're only a few miles away from downtown, and so the interns will get a chance to spend time there and spend time at Newton-Wellesley. And I think that that hybrid model is truly unique. The opportunity to begin working with mentors or other clinical faculty within the program, even within the intern year, is something that I'm very excited about offering to the new group.
I think it's something that's going to be a very meaningful year. I think all of the residents who have gone through the transitional year at Newton-Wellesley Hospital who have subsequently come to our program have across the board loved it. So I think it's going to be a huge addition to our program and something we're very excited about.